Hi all. Today we'll be dealing with a topic which is called as ethical principles. So as you all know, there are lots of questions that comes in NCLEX RN on the basis of ethical principles. We'll be dealing with 7 ethical principles today. So the first one is autonomy. So autonomy, A to A, remember, all by myself. So autonomy, all by myself. So autonomy in the sense, every patient has the right to make decisions. So if the patient has a God capacity, then that patient has a complete right to take decisions. For example, a patient has a complete right to refuse a treatment or a procedure. So that is what is called as autonomy. So the next one is beneficience. So beneficience in the sense, B for benefit. Okay, so beneficience, that is benefit. So being a nurse, we always choose to do everything for the benefit of the patient. So we never intend to harm a patient. So we always do something to benefit the patient. So B for benefit. So and we always do the care with compassion. So that is what is called as beneficience. For example, we are staying with the patient while the patient is having a procedure, or we are staying with the patient when the patient feels frightened. So these all can be categorized as beneficence. So we are doing it for the benefit of the patient. So the next one is fidelity. So F, fidelity, means faithfulness. So always remember that fidelity means faithfulness. We need to be faithful, or we need to be truthful to the patient. So example, that you have promised a commode to a patient and you have promised that you will be back within 10 minutes with the commode. So make sure that you be truthful to the patient, or you be faithful to the patient. So make sure that you fulfill that promise that you have given to the patient. So that is what is called as fidelity. So F means fidelity, means faithful. So the next one is accountability. Being a nurse, you are accountable for all the actions that you do. So being accountable means, for example, you have administered a medication or you have caused a medication error. So you are responsible, or you are accountable for that error that has happened. So you be truthful and you be accountable for that rather than hiding it. So that is what is meant to be accountability, or A for accountability means accountable. So next is justice. So J for justice. Justice in the sense being fair to the patient. So just being fair. So remember that, justice, just being fair. So you have to be fair to all the patients. So there should not be any discrimination with regards to their race, ethnicity, religion, or age. So you have to care for all the patients with justice. So just, fair to all patients. The next one is non-malale efficient. So non-malale efficient in the sense no harm, intentionally or unintentionally. So being a nurse, you are not supposed to cause any harm to the patient. For example, not administering amoxicillin knowing that the patient is allergic to penicillin. So that is what is called as non-malale efficient. So you know that the patient is allergic to penicillin, so that's why you're not administering, so that you're not causing a harm intentionally or unintentionally. So that is what is called as non-malale efficient. The next one is veracity. So veracity, we in the sense very honest. So you have to be very honest with the patient. So for example, if the patient asks you about the side effects of a medication that is being administered, or that is going to be administered to a patient, you have to be very honest to the patient, stating all the side effects that you know within your scope of practice. So that is what is meant to be veracity. Let's recapitulate what we have dealt today. So autonomy in the sense A, all by myself. B, beneficence in the sense benefit or good to the patient. Fidelity, F, in the sense you have to be faithful to the patient. Accountability, A, in the sense you have to be accountable for what you do. Justice, J, in the sense just being fair. And non-malale efficient, N, in the sense no harm or no bad to the patient. So V, veracity, in the sense being very honest. So that is all what we have dealt today. So let's look into a practice question. Which of the following is not an ethical principle? So repeat, which of the following is not an ethical principle? The first option is beneficence is telling the diagnosis of cancer to the patient. Second option is fidelity is staying with the patient during a procedure as promised. Third option is non-maleficence is not feeding a patient with aspiration risk. Autonomy is requiring the client to sign a consent. So let's deal with this again. Beneficience is telling the diagnosis of cancer to the patient. So beneficience is what we have said is benefit. So we always look into the benefit of the patient. So a patient has a complete right to know their diagnosis. So beneficience of telling the patient what the diagnosis is we are preserving the autonomy of a patient. So that is a right answer. Fidelity is staying with the patient during the procedure as promised. So fidelity is, as we have mentioned before, fidelity is faithfulness. So being faithful is we are staying with the patient as promised. So we are keeping, or we are being truthful to the patient. So that is also a right one. It's also an ethical principle. The next one is non-maleficence, is not feeding a patient with aspiration risk. So non-maleficence means no bad to the patient. So here you're not feeding a patient who has an aspiration risk. So you are not causing, or here you are protecting a patient from causing a harm. So that is also an ethical principle. The last one is autonomy is requiring the client to sign a consent. This is a tricky one. So requiring is we are asking, or we are demanding the patient to sign the consent. So the patient has a complete right to refuse or sign a consent. So here autonomy is requiring. No, autonomy is not requiring. It is of course a complete patient's right to sign or to decline a consent. So that is not an ethical principle. So that requiring made it a wrong answer. So this is how sometimes you may get a question. So this was just a practical question, just to know, just to check the knowledge of what we have dealt today. So for more of these kind of ethical principles and ethical concepts, join Medworld Academy. We'll be dealing in depth with all these NCLEX RN comprehensive theory based questions as well as theory sessions. Thank you so much.